Hi, my name is George Morville. I'm the head lacrosse coach at Kittatinny Regional High School. I recently had back surgery with Dr. Jim Dwyer of Spine Surgery Associates. I'm turning 60 this year. Looking forward to a lot more years of coaching. Through a combination of a lifetime of sports and driving off a cliff on a snowmobile, I did quite a bit of damage to both my spinal cord, my spine, and my lower back. I put up with it for a lot of years. You know, as we get older, we know we're going to aches and pains, and we kind of put up with that. It started to deteriorate along the way. I tried everything, all the traditional ways, trying to, stay in good shape, trying to do as much exercise as possible, keeping the weight off. But the more I got into continuing to coach and the more active I stayed, the more pain I had. And it got to the point where I had been through a lot in my life. I had cancer, I had open heart surgery. Those two things slowed me down. When I started to get the pain that I was experiencing with the back, that disabled me. Prior to the lacrosse season, I do a lot of hunting and fishing. I love the outdoors, and I was finding it was having some effect, but that's just me in the woods or me on the river. It was no big deal. When it got to the season, I started to lose the ability to truly coach. I could stand and yell and talk to the kids, but I couldn't go out and show them what I needed to do, and that started to affect my performance. As coaches, we try to think of ourselves as tough guys, and the kids would never pick up on it. After about the third game, I had kids coming up to me at halftime, "Coach, you all right? You're going to make it through the game?" And suddenly I got that feeling that I'm no longer fooling anybody, including myself. And that's when I really started to turn towards the idea that I do need to get this work done. I've been a member of the board of directors of our local hospital for about 20 years. I had, as I mentioned, some health problems. And when I needed a heart doc, I went to the best in New Jersey. When I needed a cancer doc, again, I went to the best I could find. When I went up and talked to some of my colleagues, they told me about Jim Dwyer. And Dr. Dwyer had an incredible reputation. It was somebody that I honestly felt I needed to talk to. I had heard that he's cautious and that he will walk you through the situation, ultimately leave the decisions up to you. Those were very important. Like any coach, you want to make all the decisions. Dr. Dwyer gave me the choice of whether or not I wanted to have the operation in a hospital or in his surgery center. Bottom line, I didn't want to waste any time. I wanted to be able to get up and going as soon as possible. And even though he kind of said, you'd be better off taking a few days off, I opted to the surgery center. It was July 12th. I woke up on July 13th pain-free. Of course, there's healing pain, where they do the cut and those different things. But what had been bothering me for the last 24 months was no longer there. I was absolutely amazed, still thinking I was probably under some type of, drugs or something, but it wasn't. He had actually taken the pressure off of all the nerves and recreated my spine with this 3-level T-lift.
I'm Dr. James Dwyer. I'm an orthopedic spine surgeon with Spine Surgery Associates. And a few months ago, I had the occasion to operate and perform surgery on George Morville, the coach for the Kittatinny men's lacrosse team. At that time, when he came to see me, he had been complaining of severe pain in his legs that prevented him from walking, let alone running or coaching his team. At that time, Mr. Morville had been through conservative care that included physical therapy. He had been using medications, had even tried spinal injections to try and improve his quality of life, to no avail. After exhausting his conservative options and reaching an intolerable level for his basically quality of life, we offered him a surgery that's called this T-lift procedure. That procedure was performed successfully at the Ambulatory Surgical Center of Somerset in a 23-hour stay room. He went home within 24 hours, was walking upright, and only taking occasional pain medications on the time of his discharge. Since that time, he's done remarkably well. He has regained the function in his legs, he's returned to all the activities that he wants, including coaching, and he's no longer taking pain medications. So we've been able to give him back his life and return him to the activities that he wants to participate in and get him back to the team that needs him as a coach.
Here it is. New season started March 1st. I'm out here the first couple of days, and it was critical to me that I could return to who I was previously in coaching. One of the things I love doing is showing the kids that I'm not only teaching them how to do it, I can still do it. Obviously not as fast and not as hard, but I can still do it. And here we are, we're about 2 days away from our opening game, and I'm warming up goalies and I'm teaching kids, full face dodges, roll dodges, and I'm able to do it without pain and in comfort.